Hi everyone, today I am going to discuss about the medical surgical nursing 2 and for the GNM second years. So there is a unit 9 nursing management of patient with the musculoskeletal system. So in the degenerative conditions of the joint, at the last class we have seen about the part 1 osteoarthritis. So osteoarthritis, it is a part 2 about the osteoarthritis. So there is a part 2, it includes the medical management. So medical management includes the acetaminophen. So it can be reduce the pain. So the patient will have the severe joint pain. So acetaminophen can be reduce the pain and it relieves from the pain. So next one is the non-steroidal anti-inflammatory drugs. So non-steroidal anti-inflammatory drugs can be used to reduce the pain and inflammation. So the non-steroidal anti-inflammatory drugs can be used to reduce the pain and inflammation, and there is a ibuprofen can be used in the non-steroidal anti-inflammatory drugs. So ibuprofen can be given to the patient to relieve from the pain and the inflammation. And next one is the narcotic or central acting agents. So there is a tramadol is the prescription pain reliever. So in the narcotics, the tramadol. So the tramadol can be painkiller and it given to the patient to relieve from the pain. And there is a next one is COX-2 inhibitors. So COX-2 inhibitors, it is the non-steroidal anti-inflammatory drugs. So it includes the paracetamol or the topical non-steroidal anti-inflammatories are ineffective for the pain relief for people with osteoarthritis. So the patient will have the osteoarthritis. There is a COX-2 inhibitors includes the paracetamol, and there is a topical non-steroidal anti-inflammatory drugs. So topical means there is a applied on the skin. So there is a ointments can be available, the COX-2 inhibitors. So the painkillers and the paracetamol and the topical NSAIDs can be effective to relieve the pain. So there is a pain can be reduced by using the paracetamol and the topical application by ointment like using on the skin. So there is a applying on the skin, it can reduce the pain and inflammation. So next one is a topical medications. So topical medications, it can be applied on the affected area. So the salicylates and the capsaicin ointments to be used to reduce the pain. Salicylate and the capsaicin. So these are all the ointments can be used to reduce the pain. So it is the medical management includes the acetaminophen and non-steroidal anti-inflammatory drugs and the narcotic or central acting agent. So next one is the COX-2 inhibitors and topical medications. And next one is the Viscose supplementation. So there is a viscose supplementation, it is injection of hyaluronic acid. So the hyaluronic acid, it is the injection and it can be directly injected into the affected knee. So by this injection we can reduce the pain and it can be provide the lubrication. So there is a provide the lubrication. So because of this lubrication, there is a joint flexibility can be occur. So the patient will move freely the joint. So the viscose supplementation, there is a hyaluronic injection can be directly injected into the knee and it can be reduce the pain and it provides the lubrication. So lubrication, it helps to the freely movement of the joint. So it is about the medical management. So there is a conservative treatment for the osteoarthritis. So conservative treatment, it can be helps to reduce the osteoarthritis. So the conservative treatment includes the exercises. So because of these exercises we can improve the muscle strength and there is a muscle movement can be occur. So because of these exercises we can improve the muscle strength and there is a movement of the joint can be occur. So because of these exercises we can improve the joint movement and also we can improve the strengthening of the muscles. And next one is weight reduction for obese patient. So because of more weight on the joints there is a causes of the osteoarthritis. So weight reduction is very important. So the patient has to be decrease the weight. So next one is braces. So the braces can be help to support the affected joint. So the braces can be helps in the movement, otherwise it also helps for the support to the affected joint. So the braces, it includes the splints and walker. So like that we can use to support the affected joint for the movement or to reduce the pressure over the joint. So while using the braces and we can decrease the pressure over the knees, and there is a use of supportive or assistive devices. So because of using of supportive or assisted devices like walkers and wheelchair, by this we can reduce the pressure over the affected joint or the knee. So we can reduce the pressure over the knee. So by this we can reduce the osteoarthritis by using the supportive and assistive devices. And next one is the hot and cold application. So if the patient having severe pain or inflammation, we can apply the cold and hot application. So by this cold and hot application we can relieve the pain and also we can reduce the inflammation of the joint. So it is about the conservative treatment, includes the exercises and weight reduction for the obese patient and braces and use of supportive or assistive devices and the hot and cold application. Next one is the surgical management. So in the surgical management includes the first one, arthroscopy. So arthroscopy, there is a small incision can be made into the joint and there is a remove the damaged cartilage. So by the arthroscopy, so by the scope, there is a by small incision, the scope can be inserted into the joint and the damaged cartilage can be removed and the damaged tissues also can be removed in the arthroscopy. And next one is the joint replacement. So in this joint replacement also called as arthroplasty. So in this arthroplasty, there is a remove the damaged cartilage or the tissues and the damaged joint can be removed. So the damaged joint can be replaced by the using the plastic and the metal devices. So by using the plastic and metal devices we can replace the joint. So there is a arthroplasty. Arthroplasty means there is a remove the damaged joint by replacing the plastic and the metal devices to reduce the pressure over the knees and there is a joint. Next one is the osteotomy. So there is a opening of the joint and they remove the damaged cartilage and the tissues in the osteotomy. And next one is the joint fusion. So joint fusion is to remove the damaged joint and fuse the two bones. So in the joint fusion there is a removal of the damaged joint and the bones can be fused together and this is done more often in areas in which joint replacement is not effective. So if the joint replacement is not effective, then go for the joint fusion. In the joint fusion, the damaged cartilage can be removed and the bones can be fused together. So it is about the joint fusion. Surgical management includes the arthroscopy and joint replacement, osteotomy, joint fusion. Arthroscopy, it is the scope is inserted into the joint by the incision and the damaged tissue or the cartilage can be removed by the arthroscopy, and joint replacement or the arthroplasty. So in the arthroplasty there is a removal of the damaged joint or tissues and by using the plastic and the metal devices to support the joint. And next one is osteotomy. There is a opening of the joints to remove the damaged tissue or the cartilage, and joint fusion is remove the damaged joint and fuse the bones together. It can be performed if the joint replacement is not effective. And next one is the nursing management. So in the nursing management includes the assist the complaints of pain. So the pain, where the pain is located and how the pain it will come, and there is a assist for the complaints of pain. So the nurse has to be assist for the pain, where the location is present and how long it can be present. So the nurse has to be checked. And next one is advise the patient to apply heat and cold. So the nurse has to be advise the patient to apply the cold and hot application. So by the cold and hot application we can reduce the pain and inflammation. So next one is encourage clients to frequently change and take a comfortable position when sleeping or sitting in a chair. So the nurse has to be advise the patient to maintain the comfortable position while sitting or sleeping. So while sitting or sleeping, the patient has to be maintain the normal position or the comfortable position. So the nurse has to be advised for the patient to maintain the comfortable position. And next one is elevate the affected joint. So by the pillows or the sandbags. So by using assistive devices we can elevate the affected joint. So we can improve the circulation to the affected joint by the elevation. So next one is advise patient to maintain good body mechanics when walking. So while walking, the patient has to maintain the good body mechanisms. And next one is administer prescribed analgesics. So what are the medications are advised by the physician, the nurse has to be provide to the patient to relieve the pain. And next one is monitor the level of inflammation. So the nurse has to be checked for the inflammation. So after the treatment and before the treatment, how the condition, the nurse has to be assist. And encourage patient for ambulation while using assistive devices. So the nurse has to be encouraged for the ambulation. So the nurse has to be encouraged for the walking and to improve the movement. So to improve the movement of the joint, the nurse has to be encourage the patient for the walking and by using the assistive devices. So by using the wheelchair or otherwise walkers. So by using the assistive devices we can reduce the more pressure over the knees and it can release the pain also. So the nurse has to encourage the patient to use the assistive devices. And next one is advise the patient for active and passive exercises. So the nurse has to be advised for the active and passive exercises. Active, the patient he will do his own, and passive exercises can be done by the nurses or otherwise caregivers. So the nurse has to be encouraged for the active and passive exercise to improve the movement of the joint. So it is about the nursing management for the osteoarthritis.